Good morning, everyone, and welcome to the Cabinet meeting. My name is Amanda Hopgood, and I'm leader of Durham County Council and chair of the meeting this morning. This meeting is being broadcast live through our YouTube channel, and before we commence with today's formal business, I'd just like to cover some of the housekeeping issues for us all to follow. Please switch off or make silent your mobile phones and keep microphones switched off at all times unless invited to speak by myself as the chair. When invited to speak, please switch on the microphone nearest to you and introduce yourself. Thank you. So with that, we'll move on to the agenda. Item 1, public questions. We haven't received any questions for this part of today's meeting. Item 2, minutes. Please, can I have a mover and seconder to the minutes of the meeting on the 14th of September?
Move, Chairman.
Councillor Shuttleworth move the minutes. A seconder, please.
Second, Chair.
Councillor Henderson to second. Can we agree the minutes are a correct record? Okay, I can confirm therefore the minutes are agreed. Item 3, declarations of interest. Are there any declarations from members this morning, please? No. So we'll move on then to item 4, which is a medium-term financial plan 13, 2023-24 to 2026-27. Can I ask Paul Darby, Corporate Director of Resources, to present the report, please?
Thank you, Chair, and good morning, members. This report builds on the report we considered at Cabinet in July, where at that point our MTFP forecasts were estimating that we had a £21.9 million budget gap next year and around a £55 million gap over the next 4 years. Since that report was considered, we've updated the forecast for a range of national and local issues. The updated MTFP planning assumptions are set out in the report at paragraph 43 and include revised estimates for pay inflation based on the local government employers' pay offer in late July, revised assumptions building in the CPI impacts on top-up grants and on our care fees, and updated estimates for some of the major contracts that have RPI or CPI-linked increases within them, and on our energy price inflation for next year. In terms of energy price inflation, whilst there is a requirement for a significant budget uplift next year, it has been assumed that over the following 3 years, prices gradually return back to more reasonable levels. We've reflected on the recent announcements on the planned withdrawal of the National Insurance Health and Social Care Levy, which reduces our costs next year. We've also updated the figures to include updated estimates for growth in our looked after children and home to school transport budgets, which are significantly overspending once again in the current year and require growth in the base budget. We revised our assumptions in terms of the fair funding review and assumed that this will not now take place within the current planning period, which was confirmed last week. The net impact of these changes is that whilst the overall scale of the challenge over the next 4 years is slightly less than we were previously forecasting back in July at around 53 million instead of 55 million, the impact is much more front-loaded and the gap in 23-24 is now £37.4 million, £15.5 million higher than previously forecasted, making balancing next year's budget significantly more challenging. The MTFP forecasts do not assume any significant additional investment by the government into local government next year, which is what is required to offset these unavoidable inflationary pressures, but equally they do not include any forecast cuts to government grant funding to the sector, which the IFS and other commentators are noting may be forthcoming based on the fiscal statement made a few weeks ago. We wait with interest the government's budget statements on the 31st of October. As was the position in July, the MTFP forecasts factor in and a net of additional income generated from assumed council tax increases of 2.99% next year and the year after, and 1.99% per annum for the final 2 years of the MTFP planning period. The report sets out details of nearly £18 million worth of savings proposals that have been developed. The savings proposals are set out in detail at Appendix 2, and the report includes a summary of these and the impact assessment that has been completed for them in paragraphs 52 to 73. The impact assessment is attached at Appendix 4. Nearly £12 million of savings are available in 23-24, and if ultimately implemented, will help close the gap in next year's budget to around £25.5 million. All of the savings proposals that are being developed will be subject to consultation over the coming months as part of the budget and MTFP consultation process, through APs and through meetings with strategic partners and key stakeholders. The outcome of the consultation will be reported back to Cabinet as part of the final deliberations on the budget later on this year. The report highlights that a review of all reserves is underway to identify options to reprioritise resources, if required, in order to increase the MTFP reserve, the corporate ERVR reserve and the commercial reserve. This strategy will be necessary if no further government support is forthcoming, as we will need to use around £25.5 million worth of reserves to balance the budget at this stage based on these updated forecasts, and there is insufficient corporate capacity to do so at present. Using reserves to that level is not a sustainable position to be in and will only buy us some time to develop more sustainable budget solutions when we come to balancing the following year's budget. Any reprioritising of earmarked reserves to meet budget shortfalls would have an impact on the projects and programmes that they were set aside to fund, and therefore major projects and programmes have been put on hold at this point whilst we take stock and await the finance settlement and have more certainty over our funding position next year and beyond. With that, Chair, the recommendations are set out at paragraph 30.
Thanks, Paul. Can I invite Councillor Richard Bell, Deputy Leader and Cabinet Portfolio Holder for Finance, to move the report, please?
Thank you, Chair. I would like to thank the officers for this thorough, though sobering report and the huge amount of work that underpins it. The report outlines the significant and escalating financial challenges we are facing in balancing our budget next year and across the next 4 years. The challenge and uncertainty we currently face is unlike anything this Council has faced in many years. This makes our budget planning very challenging. When our budget for the current financial year was approved in February, we were concerned about the ongoing impact of the pandemic and uncertainty about future local government finance settlements. While these issues remain of significant concern, they have been overshadowed recently by the impact of high inflation, especially in relation to fuel, energy and transport costs, and also our wage costs, which are already significantly above our original forecasts. We are also facing huge and significantly increased demand on our social care budgets, particularly our budget for looked after children, and significant cost pressures in our home-to-school transport budgets. The Government has recently announced some welcome changes to scrap the increase in national insurance and measures to cap energy costs for an initial period of 6 months. And while this support is welcome, much more is needed if we are to avoid significant cuts to public services going forwards. Next year, we will face a staggering £75 million of additional cost pressures. After we factor in tax-based changes and council tax increases, expected changes in government grant funding and the savings proposals we have developed, we are still facing a £25 million gap in the Council's finances next year. I have already written to the new Prime Minister and to the Chancellor to outline the challenges the Council and the wider sector face. We will continue to lobby with partners regionally and nationally on this issue. Put simply, the Council and the wider sector simply needs more government grant support. And without additional support, I would venture that many authorities will simply not be sustainable in the next few years. There is a concern that we are ultimately given some additional council tax-raising powers to help address some of these pressures, which will place us in a very difficult position when we ultimately come to set the budget next February. The forecast deficit of £37.4 million next year and a funding deficit of around £52.8 million over the next 4 years is after an assumption that we increase council tax by the maximum currently permitted, 2.99%, which is in line with government expectations. When the savings proposals that have been developed are factored in, the deficit next year reduces to £25.5 million and to £35.1 million over the next 4 years. Those on low incomes are currently afforded significant protection through access to support through the council tax reduction scheme. Balancing our budget next year and across the next 4 years will be a huge challenge based on these forecasts. It is vital, however, that we plan for the medium term and tackle these problems head on. The report provides details of a range of savings proposals that have been developed based on the initial forecasts we considered in July. These savings, which total around £17.5 million and which are set out in detail at Appendices 2 and 4, will be subject to consultation over the coming months as we head towards our budget-setting meeting in February next year, when final decisions on council tax and on our savings plans will ultimately be taken. We await, with a combination of trepidation and hope, the local government finance settlement, and in advance of that we are undertaking a review of all of our commitments in order that we are best placed to make some difficult choices to reprioritise our resources should we need to. We cannot use reserves to underpin the base budget without a plan to address the underlying problems, and while the report identifies a potential 25 million use of reserves to balance the budget next year, 23-24, we will move swiftly to develop more sustainable budget solutions should that need materialise. The uncertainty that exists will not be resolved until we understand what the national funding position will be in a month or so's time. With that, Chair, I support the recommendations as set out in the report at paragraph 30 and move the report.
Thanks, Richard. As has been outlined, the updated MTFP forecasts before us show even more challenging position than the initial forecasts we considered back in July. The significant unavoidable cost pressures we are experiencing include, but are not limited to, inflationary increases in pay, energy, waste and transport contracts, national living wage increases, and the enduring cost and demographic pressures in our looked after children and in our home to school transport budgets, all of these which are beyond our control. As I mentioned back in July, we face a perfect storm of unprecedented cost pressures, the likes of which we have not seen in a generation. The updated forecasts, as have already been highlighted, show we will have a 52.8 million shortfall to bridge over the next 4 years, with 37.4 million, or 71% of that, falling next year. Based on the initial forecasts in July, work has been done on a range of potential savings that could help us in closing those gaps. In July, there was some indication of a consultation on a 2-year settlement for local government announced at the LGA conference. That did not materialise, but the case for a multi-year settlement is clear, and we cannot continue limping on from one year to the next. I know Councillor Bell has and will continue to lobby government directly for the additional financial support we need to help balance our budgets and meet the needs of our local residents. That said, the soundings coming from government at this time are not good, and the recent fiscal event offered little by way of comfort that the government at the moment is listening to our calls for additional funding. In closing, I would add that the report before us today and the savings proposals contained within them will be subject to consultation over the next few months. We are not setting the budget or making any final decisions today. It is important that we plan for the worst, and if these forecasts do materialise, then we will need to meet the challenges head on. With that, I'm happy to second the report. Is there anyone else wishing to speak on the report? Yep, Councillor Wilkes.
Thank you, Chair. There's 3 things I'd like to comment on. The first is the same message that yourself and Councillor Bell have said, and that every single council in this country is sending to the government. Budget pressures are such that we're having to find cuts which are unsustainable. Local government needs an increase in revenue of over 3.7 billion. This government has just bailed out the country to the tune of 89 billion for energy bills, or thereabouts. That includes subsidising the energy bills of billionaires and millionaires. But it can't tell us if we're getting a penny towards the massive costs and pressures that we're facing. So we as a local authority are having to look at making savings which may end up not being necessary, but are great for negative newspaper headlines and for worrying people. We shouldn't be put in this position. Second point I want to make is more local, and I know, yet again, I think there's no Labour members, certainly no Labour leader here attending Cabinet. A decade ago, I can remember hammering the Labour administration here for their wasteful practices. And this included things like officers having 3 mobile phone contracts and not even knowing it, or officers having retired and contracts still running. It included the then Labour-run local authority buying 17,000 packs of post-it notes a year, included branded, multicoloured and scented ones. And it also included the Labour chair and vice chair getting over £12,000 a year in clothing allowances. Now, I thought we'd seen the back of all the waste and all the failures over the last decade after years of us in opposition challenging Labour waste. But sadly, when you're in opposition, you don't always find everything out. You can't always insist on things being done. You have to be in Cabinet to be able to get the information you need. And what we're finding is systematic failure by Labour to look after the public's money. Failure to use assets properly, a failure to raise the right levels of income and more. Indeed, several months ago, I asked for all departments to be brought together to find some major ways of save energy. We're facing energy bills of over £21 million this year, and I'm determined to find savings to this cost. What I didn't expect was to find that some of the practices we've inherited from Labour have been unconscionable. And the same goes in other areas too. So our commitment continues to run this local authority for the people of this county and to continue to root out waste left by Labour, and we're cracking on with it, whilst also making some excellent improvements across a wide range of services, from waste to highways, children's services to wardens, social care to leisure. The final thing I'd like to say, possibly the most important one at the moment, is that I am more and more convinced that the officers we have working at Durham County Council are doing an amazing job in difficult circumstances across all departments, including numerous excellent new appointments over the past year, bringing new ideas. It takes a long time to change the way things are done. It's not easy when the government's doing what it's doing. But I'm finding that we are moving more and more towards being a can-do council, unlike under Labour, where frequently it was Labour says no, council says no. So we get on with the job, Chair, while challenging government to provide the revenue funding we need to continue to provide quality local public services. Thank you, Chair.
Thank you. Does anyone else wishes to speak? Councillor Hood.
Thank you, Chair. Councillor Chris Hood, Cabinet Member for Adult and Health Services. Firstly, I'd like to thank Paul and his team for their hard work and diligence at a time of immense strain. Never in this Council's history have we had to face the financial pressures that are now before us, and the challenge for Paul and his team is an incredibly difficult one. However, my main reason for speaking is to both assure the residents of County Durham and address claims made in certain press outlets. The very first line of paragraph 2 of the report clearly states, and I quote, "The Council is continuing to operate in a period of significant financial uncertainty. We are uncertain of what is coming in the future. The impact of inflation is affecting all council services, with no part of the council's budget unaffected. And despite the foresight of building in a 40% increase into base energy budgets this year, energy costs will still be significantly above this. The impact of high inflation, especially in relation to fuel and energy prices, is now and will continue to affect all councils across the United Kingdom. And that includes increases to our many providers' budgets who support the most vulnerable people in society. However, paragraph 14 clearly states, the strong financial position of the Council will ensure that the Council is well placed to react effectively to any outcome. That said, without significant additional government funding, the Council will be placed in a challenging situation and will be required to make very difficult decisions. This Council, this joint administration, has done what it promised to do, to serve all the residents of County Durham. We will continue to protect our residents, especially our most vulnerable. And to address the claims made by certain press outlets, over the last 10 years, the emphasis of the previous administration has been to minimise savings from frontline services by protecting them wherever possible, whilst maximising savings in management and support functions and by targeting increased income from charging. We're doing the same. The report makes it abundantly clear the problems we face now and may face in the future will not have been created by this joint administration, but from external decisions made away from County Hall. The key word throughout the report is the word proposals. These are not decisions. They are proposals by officers, not decisions by members. This joint administration will continue to do what we originally said when voted for by the residents of County Durham, who, in their majority, wanted true democracy and to be listened to. And that is to work in the best interests of everyone in County Durham, looking closely and not just at the bottom line, but at the impact that our decisions have on our residents. Thank you, Chair.
Thanks, Chris. Is there anyone else wishes to speak on the report? Okay, can we agree the report and its recommendations? Okay, I can confirm that the recommendations are agreed. Item 5, concessionary fares budget. Can I ask Mark Jackson, Head of Transport and Contract Services, to present the report, please?
Thank you, Chair, and good morning, members. The report seeks approval of three important issues for the Council. Firstly, the forecast savings from the ENCTS budget to be redirected during 2023 to 24 to support bus services across the county and subsequently to be reviewed annually. Secondly, it asks Cabinet to transfer to the local bus services the revenue support to procure the previously commercial services wherever resources allow. And finally, it seeks approval from Cabinet to delegate authority to the Corporate Director of Regeneration, Economy and Growth in consultation with the Cabinet Portfolio Holder for Economy and Partnerships to finalise the service proposals. In March 2022, Cabinet was advised of the uncertainty of government support and the reduced number of passenger numbers as a result of the COVID pandemic. At that time, Cabinet agreed short-term support to bus services in County Durham by redirecting funding from the ENCTS budget, which at that time was forecast to underspend by 1.934 million during 2022-23. At that time, it was envisaged that with an increasing return to more normal life, bus patronage would continue the recovery closer to pre-pandemic levels. The current position, however, is that passenger numbers remain subdued and temporary government financial support for the industry is set to be withdrawn. As a result of the impact of the pandemic, bus passenger numbers are currently between 80 to 90% of pre-pandemic levels. Industry forecasts from organisations such as Transport Focus predict that bus ridership will not recover to pre-pandemic levels for several years. Bus operators are also facing significant cost pressures, and the end of central government pandemic-related financial support for the sector is due to end shortly. The level of ridership by ENCTS passengers has been materially depressed, currently reduced to around 65 to 75% of pre-pandemic levels. Although it is likely to recover, it is thought that it may remain at a somewhat lower levels than other passengers due to more material behaviour changes, including a large increase in online shopping by older people. As a result, bus operators will receive less council bus-related funding. The Department for Transport has been clear in stating that if concessionary patronage does not increase and the funding spent on local bus services declines, local authorities should expect funding from the revenue support grant to decrease in future spending reviews to reflect this position. In County Durham, we could potentially retain up to £2 million of funding next financial year, which could be used to offset many of the services which will be withdrawn by bus operators as not being commercially viable. The report seeks approval to allow the £2 million forecast savings from ENCTS budget to allow the County Council to transfer to the local bus service revenue support budget and be reviewed on an annual basis. The recommendations are set out in paragraph 10, and Cabinet has recommended that the forecast savings from ENCTS be redirected during 23-24 and subsequently reviewed annually. That the County Council to transfer to the local bus services the revenue support to procure the previously commercial services wherever resources allow, and to delegate authority to the Corporate Director of Regeneration, Economy and Growth in consultation with the Cabinet Portfolio Holder for Economy and Partnerships to finalise the service proposals. Thank you, Chair.
Thanks, Mark. Can I invite Councillor Elizabeth Scott, Cabinet Portfolio Holder for Economy and Partnerships, to move the report, please?
Thank you, Chair. As the portfolio holder responsible for transport, I am acutely aware of the problems that have beset bus services as a consequence of the coronavirus pandemic. The huge reductions in patronage due to lockdowns and changes in travel demands place great strain on the sector, and through commendable partnership work between our own council officers and the local bus operators, we were able to maintain a viable network which was so important for the residents of County Durham. We know that bus services are a lifeline to our residents in County Durham, helping them to get to and from their places of work, schools, colleges, and enabling them to access essential services. That's why we've devised this proposal to support bus companies to keep running services which may be at risk of being cut with little certainty at present over funding future. Our aim is to use the funding retained from lower concessionary fare reimbursement to support areas that would otherwise be without a bus service. Particular attention will be given to preserving times that allow key travel opportunities, such as capacity at school time or journeys used largely for those travelling to work. However, it is important that council funding is directed where it's needed. It's therefore prudent, alongside the support being proposed in this report, that further consideration be given to determining the local strategy to supporting services in the short, medium and long term with a view to supporting the most effective transport options for our communities within the resources available. I'll be working with officers over the coming months on a proposal and returning to Cabinet with further information over the months to come. In the meantime, I'd like to move the recommendations set out in the report.
Thank you. Can I invite Councillor John Shuttleworth, Cabinet Portfolio Holder for Rural Communities and Highways, to second the report, please?
Thanks, Chair. Local buses are vital in getting our local residents to work, school and enables them to access key services. I'd also like to endorse giving further consideration to financially supporting bus services in the short, medium and long term so we have the most effective public transport options within the resources available. I look forward to receiving further details in this, but in the meantime I'd like to second the recommendations set out in the report and support the aims held within the report. Thank you.
Thanks, John. Is there anyone else wishing to speak to the report? Okay, can we agree the report and its recommendations? Okay, can confirm that the recommendations are agreed. Move on to item 6, the Director of Public Health Annual Report 2022. Can I ask Amanda Healy, Director of Public Health, to present the report, please?
Thank you, Chair, and good morning, members. I'm delighted this morning to be able to present my annual report. As you know, the Director of Public Health's annual report is a statutory responsibility for myself to write a report and for the Council to publish that report. This is my 5th annual report, and I think this year has been, it's been a year of transition. The previous reports, you may remember, focused around a fictional family, the Taylor family, and both the challenges they've had as a family and how they interacted with their community, but also the assets. Those are the things that protect people's health and well-being. We've started to move away from that and actually draw out in this report, which I hope you've seen throughout, real case studies from our local residents and again, the challenges that they face in terms of their health and well-being, but also some of the really positive things that they have done with others to protect and improve their health and well-being. We've now moved also towards the thoughts around the building blocks for good health and how those building blocks, which are underpinned by things like, we've just heard about transport, also housing, people's access to finance and a good job, a good education and an environment that's conducive to health, they are the underpinning building blocks for good health and well-being, built upon by the ability to make choices and healthy choices as easy as possible, and then their access and fair access to health and care services. So they all come together in terms of the building blocks for good health, which are outlined throughout the report. It's also been a year of transition in terms of COVID, and that is also covered within the report. Importantly, I think the Director of Public Health's annual report draws together and gives a summary, and the link is in the report to Durham Insight, and that gives a summary of the health and wellbeing status of our local residents, as well as some deep dives into certain areas. We know that COVID has had a profound and lasting impact on our residents, both directly in terms of people affected by COVID and the impacts of COVID on health and well-being, and sadly, obviously, loss of lives. However, it's also some of the indirect impact of COVID that we are now seeing taking place within County Durham. That includes, obviously, where we are starting to see that impact on our children and young people's mental health and well-being, and in particular, the projection of a 20% increase in impact on children's mental health services over the next 5 years. And it's these facts that we have to use in our planning and use of our resource. We've also obviously seen the assets that we have in our local communities. So we know that during COVID, there was 130 mutual aid groups set up before we even set up our COVID hub. So again, it's how do we make the most and work with our residents to maximise those assets to protect health and well-being as we move into living with COVID. And at this point in time, as we head into winter, it's ensuring our vaccination programmes, for example, have the highest uptake. Sadly, where we have seen progress previously at a national level and at a local level, some of that is now stalling. And one of the areas that we're looking at closely is life expectancy and also healthy life expectancy. And we do see a difference between our residents in County Durham and the rest of the UK, and some differences within County Durham. And the report highlights some of those differences. And that difference in terms of our healthy life expectancy, the years that people can expect to live in good health, then does have an impact on our health and care services, because people are likely to access them earlier and need more of them. It also impacts on productivity and the ability for people to be healthy in the workplace. And that's what we want to see. We want to see a really productive and healthy workforce. So these are the things that we, again, will need to use as we are planning our services and how we engage with our communities. Some of those and all of those inequalities are unjust and unfair. However, it doesn't mean to say that they can't be changed. And that's the challenge, and that's the challenge we need to face head on. And just talking about some of the financial challenges in terms of our residents' health and well-being. However, what we have seen, there are some areas in County Durham where we are improving and are either the same as other parts of England or better than other parts of England. And certainly we did see that during COVID in terms of our uptake of a vaccination programme. We're actually seeing, some good outcomes now starting to come through and with our clients who are opiate drug clients, for example. And we've seen investment from government in the area of drug and alcohol treatment services that can support our residents who are affected by drug and alcohol to come through and out of addiction, hopefully. And other issues in terms of some of our screening programmes, where actually we are higher than other parts of the country, which is a really positive area. However, ultimately, we do still have the challenges, for example, in terms of many of our children and living in low-income families, which doesn't mean to say that their families aren't working, it just means that they may have a very low income. What we have done, and this approach has been endorsed and supported through the Health and Wellbeing Board over the last couple of years, is our approach to wellbeing. And that is really, and I guess again you'll see a few examples of this in the full report, but it's really about how we do with our communities and not do to our communities. We know if we can work with people, their outcomes will be better, their health and their well-being outcomes, which impacts on every other aspect of their life. And this approach has been very much about taking the best evidence, but actually talking to people, but also thinking about how we commission services. And the Durham Mental Wellbeing Alliance is a really, really good example of how some really innovative practice by our commissioning leads have brought together services who deliver in relation to mental health, and where usually we would give a contract, we would give them key performance indicators. They've come together because they know the residents who they're working with, and they've identified that in an alliance, and collectively they will prioritise the services that will be delivered. So a really different way of working, and hopefully one that can be extended elsewhere. Living with COVID, again, we're in this transition period of this year. We are at the moment seeing a slight increase in COVID. However, I hope that the report really highlights is that really, really strong partnership working that has taken place during COVID and working so closely with our residents. And there are a few examples within there. So some of the things that we responded to locally in terms of communication that came through from our local community champions, and they were telling us what residents were feeling. Just some amazing work through our schools and early years in terms of the reports that they would make and how they managed COVID in the education settings, and certainly into some of our secure settings as well. And then our PPE cell, which was also the point of distribution for lateral flow tests, which enabled those tests to be delivered out, particularly to people who were more vulnerable when certainly some of other elements were stood down. What we've been able to do as a result of COVID is also retain a protecting health team within public health, which now puts us in a good position for other communicable diseases and threats which we will no doubt face in the future. You can also see in the report again, we introduced an award scheme locally for local residents to be nominated, and you'll see Chloe, there was quite difficult as it is to get young people to come forward, so Chloe became the face of our kind of Safe COVID County Durham marketing campaign. And then Alfie was he had used his own money to develop packs for residents in where he worked, and some survival packs for youngsters. So there's some really great and heartwarming examples of how our residents have supported others, and it's that kind of culture that we want to kind of really keep going as now we move into a more probably challenging period for people's health and well-being. A recommendation from last year was to try and bring the issue of smoking back to the fore, which I guess as a Director of Public Health is probably one that's been at the centre of my work all the time I've been worked in public health. Smoking remains the single largest cause of preventable death. 2 out of every 3 people who smoke will end up dying because of smoking, and because of the targeting of the tobacco industry to try and keep people smoking as long as possible, and to explore and exploit new markets, and to try and get young people starting to smoke. We've got a really comprehensive approach to smoking in County Durham. However, we really, really need to do as much as possible, because what you'll see in the report and what you can see on this slide is the impact that it has in terms of both our deaths, but also our rate of smoking. And if we're wanting to be ambitious and try to get to the point where it's almost denormalised in terms of smoking up to 5%, we need to have another 40,000 people give up smoking, and obviously no more people starting to smoke. So that is a challenge that I think we are setting ourselves, but absolutely working with others. And I think what we've seen, certainly in the last year, we've seen our NHS partners really step forward in terms of tobacco dependence within the NHS. Our local foundation trust, our mental health trust, was already doing a lot of work on tobacco. And we are the lead commissioner for Fresh from County Durham, which is the Tobacco Control Office for the North East, a really systematic approach to smoking. So really touching on issues such as poverty, smoke-free homes, a fantastic trade and standards department in County Durham, which is seeking to ensure that those who have access to cigarettes do not have access to illicit cigarettes, and there's been some big hauls over the last year. So this is an area which we will really, really focus on in the coming year, and is a way again of potentially lifting our residents out of poverty if we can support them to give up smoking. And over the course of the coming year as well, we will be engaging both with our schools, but also our residents in terms of a briefing around vaping. I know that's been very topical recently, and it is much, much safer for those who are smoking to use vaping as an aid to stop. And I guess, again, here what we can see is some real residents' examples, and certainly Kathy's experience. So she was 49 the day before her 50th birthday when she was diagnosed with cancer, and having to tell her children about that. But actually some really positive advice to others, you know, ex-smokers who've been through difficult times, are also really strong advocates for people not starting. So to think, never think it'll never happen to you. And certainly for Alan, it was very much about that instant improvement in health, and it does happen as soon as people stop smoking. And then I guess the last part of the report starts to outline some of those priorities in terms of the building blocks for good health, which will be built on in future reports. As I said, this has been a bit of a transition report. So we're really thinking about people being healthier, and the area of focus around this that I've drawn out in the report is around mental health, and then fairer. So really thinking about, have we got fair? We often think of the most vulnerable, but actually is it across our residents, and ensuring they've got fair either access. So the example here is children's mental health in schools, and to be protected. And that's not just from things like COVID and other communicable diseases, but potentially things like domestic abuse. And you'll see in the report some really, really good examples of where we are starting to build on those building blocks. So the Now You're Talking campaign was developed with our local residents. It was to get local people talking about mental health. It's just been evaluated. It's been evaluated really positively. Obviously, we've had World Mental Health Day this week, and we're hoping to roll this out further. The Young People's Health and Wellbeing Framework is a way of really thinking about getting our schools to think about, particularly around mental health, but schools can choose to do mental health or physical health. And there's a great example in there from Oxclose Primary School. And we're building our work in relation to children's health and wellbeing in our schools on an ongoing basis. And then the last example there is some work around domestic abuse and the Respect programme, which is about children to adult violence, and that's a new programme which has been introduced this year. So in summary, we know that we're heading into a challenging winter in terms of our issues around fuel poverty, food poverty, challenges in terms of our economy, and I guess the report has set out some of our challenges in terms of health and well-being. However, as I've said also, those things are things that we can address together. So as we work as right across the council and with partners, as we have during COVID, hopefully taking those things forward with our residents, working with others and with partners, and most importantly, our local communities, I hope we will be able to make people's lives healthier, fairer and protected. Thank you, Chair.
Thanks, Amanda. Can I invite Councillor Chris Hood, Cabinet Portfolio Holder for Adult and Health Services, to speak to the report, please?
Thank you, Chair. I am pleased to welcome the independent annual report from Amanda Healy, Director of Public Health. The Director of Public Health introduces the concept of building blocks of good health. These building blocks of good health, how much money we have, the quality of the house we live in, the natural environment surrounding us, our access to transport, education and work, all impacts on our chances of living a long and healthy life. It recognises that the impact of social and environmental conditions in which people are born, grow up and live with do not give everyone an equal chance of living long and healthy lives. The DPH annual report provides an update on our COVID-19 response and the transition to living with COVID-19. In addition, the report provides an overview of the health and well-being of County Durham's population and actual examples of how the approach to well-being is being implemented. I'm pleased to see the report for 2022 provides an in-depth focus on the progress to making smoking history in County Durham. Smoking remains the single largest cause of preventable deaths and one of the largest causes of health inequalities, and remains a key priority for the health of our local residents. Smoking levels within County Durham are reducing. However, it is still higher than the North East and England average. In County Durham, we want to achieve 5% by 2030. To get to this figure, we would need 40,100 fewer smokers. The impact of COVID-19 and the cost of living increases make it even more important for us to embed health and well-being in the building blocks for good health. Future annual reports will ensure good building blocks for good health remain at the heart of public health action. I'd like to thank Amanda and her team, and I therefore propose that Cabinet agrees to publish this report. Thank you, Chair.
Thanks, Chris. Can I invite Councillor Alan Shield, Cabinet Portfolio Holder for Equality Inclusion, to speak to the report, please?
Thank you, Chair. I'm also pleased to receive the Director of Public Health's statutory annual report for 2022. The report has many examples of the work that is being carried out to make individuals' lives healthier, fairer and protected, and a reminder of how personal health and well-being underpins everyone's life. Can I say, Chair, on a very personal note, my accident and resultant injuries is a testimony to how precious life is. The annual report highlights helping protect people from domestic abuse. The Domestic Abuse Act of 2021 aims to support victims, including children and young people, to live free from abuse, coercion and control. The Act highlights the challenges that families experiencing domestic abuse can face. This includes recognising child adolescence to parent violence and abuse as a form of abuse. I'm pleased to see the case study from Kelly and Talia on the respect of the Young People's Programme. You can see that the interventions have helped this family to improve their communication. The report provides an update on healthier, fairer and protected priorities and concludes with a section on previous recommendations and conclusions. No work to improve public health can be achieved without working with others, our partners, and most importantly, our local communities. I therefore second the Director of Public Health's annual report. Thank you, Chair.
Thanks, Alan. Is there anyone else wishing to speak to the report? Okay, can we agree the report and its recommendations? Okay, I can confirm that the recommendations are agreed. Thank you. Item 7 is a Road Safety Strategy 2022 to 2032. Can I ask Mark Jackson, Head of Transport and Contract Services, to present the report, please?
Thank you, Chair. The report seeks authorisation for Cabinet for the implementation of the new road safety strategy. The strategy is a partnership document to assist in the coordination of all road safety activities and is linked to the aims and objectives within both the County Durham Vision and the Safe Durham Partnership Plan. Paragraphs 9 to 14 of the report outline the background to the strategy and how this strategy will replace the existing outdated strategy and development plan. It is to note that the previous strategy was in place to meet specific measures set by the Department for Transport and was delivered through a specific road safety grant by the County Durham and Darlington Casualty Reduction Forum that consists of the Council and partners as identified in paragraph 11. Paragraph 15 explains that this process has ceased and has been replaced by a road safety statement that does not include any specific performance targets or additional funding to aid delivery. And within this context, the County Durham and Darlington Road Safety Partnership has continued to meet and requested to develop a new road safety strategy to assist with the coordination of all activities against an agreed delivery plan. A new strategy was produced and a consultation exercise was undertaken in early 2020 and continued during the beginning of the pandemic and national lockdowns. However, publication of the strategy was delayed by the impact of the pandemic. Paragraph 20 highlights the impact and the need to review the strategy due to the nature of delivery of road safety education activities by the Council and partner agencies. Paragraphs 23 to 32 illustrate the consultation process and how comments received have been incorporated into the new strategy. Feedback was also provided to support from the 7 key user groups listed within paragraph 23 who have been identified as at risk from injury. The new strategy is attached and details the objectives, the benefits, the approach to delivery through education, engineering, enforcement and evaluation, the legal framework of the Council and partners for implementation of the strategy, casualty statistics from 2010 to 2020, and the value of injury prevention within the county. The final section of the strategy is to monitor progress and implementation of the delivery plan, to which annual reports will be issued to all partners, detailing the performance of the partnership in respect to meeting the delivery plan and addressing the safety of key road safety groups. The recommendation is set out in paragraph 8, with Cabinet recommended to note the report and authorise the implementation of the new road safety strategy. Thank you, Chair.
Thanks, Mark. Can I invite Councillor Elizabeth Scott, Cabinet Portfolio Holder for Economy and Partnerships, to speak to the report, please?
Thank you, Chair. I welcome this very important strategy. Road casualties in County Durham have reduced in recent years, which is to be welcomed. However, we continue to strive to reduce road casualties even further. Every fatality is a tragedy, and serious injuries can be life-changing and far-reaching in their consequences for the victim and their families and friends. This strategy will provide a foundation for additional road safety programmes to be designed, implemented and evaluated. The strategy will also see targeted road safety education, training and campaigns in schools and colleges, also being delivered in communities and neighbourhoods. I'd therefore like to move the recommendations set out in the report.
Thanks, Elizabeth. Can I invite Councillor John Shuttleworth, Cabinet Portfolio Holder for Rural Communities and Highways, to speak to the report, please?
Yeah, thanks, Chair. I just want to say I support the implementation of the new road safety strategy and its delivery plan. Its focus on activity with key road users and the fatal for risk-taking behaviours. Road safety is an important topic within rural communities, and I welcome the inclusion of rural riding campaigns aimed at leisure bikers and measures to highlight the dangers of illegal and inappropriate speed in communities. And I know that because I see that every day on roads, certainly in the west of the county anyway. I note that the strategy requires a partnership response for its delivery, and there is a mechanism in place for annual reporting against the measures set out within the strategy's delivery plan. That based, I'd like the second recommendations in the report. Thank you.
Thanks, John. Is there anyone else wishing to speak to the report? Okay, can we agree the report and its recommendations? Okay, I can confirm that the recommendations are agreed. Item 8, Health and Wellbeing Board Annual Report 2021 to 2022. Can I ask Jane Robinson, Corporate Director of Adult and Health Services, to present the report, please?
Thank you, Chair. Good morning, members. This is the 7th Health and Wellbeing Annual Report, which highlights some of the board's key achievements during 2021 to 2022, including firstly overseeing the coordinated response of the COVID-19 pandemic. Since the last Health and Wellbeing Board Annual Report was presented to Cabinet in 2019, the response to the COVID-19 pandemic dominated the work of the board. The Health and Wellbeing Board has overseen the local COVID-19 outbreak management plan, which included the rollout of the COVID-19 vaccination programme, our local COVID-19 testing offer, and support to our communities, particularly people who are vulnerable and needing to self-isolate. The Health and Wellbeing Board oversaw the allocation and expenditure of the Contain Outbreak Management funding, which supported a diverse range of projects, including increasing access to testing and vaccination, improving the quality of life for people living with long COVID and for people on NHS waiting lists, targeted work to support vulnerable populations, including those needing emergency housing and children and young people experiencing mental health issues. Evaluations from the bids have shown how this funding has helped to develop future programmes and service plans. The Health and Wellbeing Board functioned as a member-led local outbreak engagement board to answer crucial questions posed by members of the public around the pandemic and local response. Secondly, the work of the board has supported work to reduce health inequalities. The Health and Wellbeing Board have provided a coordinated approach to key health and wellbeing marketing campaigns to ensure partners provide a clear message on issues which impact on health inequalities. For example, collaborating with the Stop Smoking Service and Fresh Regional Tobacco Control Programme on a County Durham campaign raising awareness to the risks of smoking, benefits of quitting and help available, targeted in areas of high smoking prevalence. Under the Health and Wellbeing Board's Starting Well priority, partners have continued to promote and raise awareness of the Healthy Start vouchers available for families to buy baby milk and healthy foods through staff training and communication. The focus on uptake has led to an increase from 54% to 68%, higher than the regional and national average. The third area is really ensuring local needs are prioritised, and the new integrated care system for the North East and North Cumbria, which was implemented in July 2022, and through the developments of plans for the system, the Health and Wellbeing Board shared feedback and expressed strong views that County Durham should not be disadvantaged in the new system. Chair, the overall message from the annual report is that a lot of excellent work has been carried out during a particularly challenging time for public health nationally. Our approach to partnership working and supporting our communities progressed significantly during this time, and we are working hard to take forward the learning, good practice, expertise and collaborative relationships to inform future endeavours, and our refresh of the joint health and wellbeing strategy, as well as regional work with the integrated care system. The recommendations are outlined at paragraph 4.
Thanks, Jane. Can I invite Councillor Chris Hood, Cabinet Portfolio Holder for Adult and Health Services, to speak to the report, please?
Thank you, Chair. As the new Chair of the Health and Wellbeing Board, I'm pleased to present the Board's annual report for 2021-22, which outlines the achievements partners have made during that time. Partners worked together through one of the greatest public health challenges in living memory, to oversee the rollout of the COVID-19 vaccination programme, our local COVID-19 testing offer and support to all of our communities, particularly those who are vulnerable and needed to self-isolate. The County Durham Together Community Hub provided a response, flexible single point of access for people who required support to remain at home, and mobile pop-up vaccination clinics were delivered in communities to ensure equitable access to the COVID-19 vaccination. The Health and Wellbeing Board functioned as our member-led local outbreak engagement board to coordinate the response and support people to understand the issues and influence local recovery planning. The Health and Wellbeing Board has adopted the County Durham approach to wellbeing, which encourages all organisations and services to prioritise well-being and involve people in decisions that affect them. A new self-assessment framework can be used by organisations to reflect on how they could support better health and wellbeing outcomes in their everyday work. Given the impact of the extraordinary events of the last 2 years, we have decided to refresh the joint health and wellbeing strategy in 2023 to ensure it accurately reflects the needs of our residents and can drive health and wellbeing improvements across the wider system. I am aware that my new role as Health and Wellbeing Board Chair will provide many challenges as we recover from the varied impacts of the pandemic and its restrictions through an anticipated period of prolonged hardship, and I look forward to working with partners to maximise our shared resources and work effectively for our residents. The Health and Wellbeing Board is committed to learning from recent events, responses and ways in which we have worked together to continue to achieve positive outcomes for our residents, and I look forward to providing Cabinet with future updates. I move the recommendations set out in the report.
Thanks, Chris. Can I invite Councillor Ted Henderson, Cabinet Portfolio Holder for Children and Young People, to speak to the report, please?
Thank you, Chair. As a portfolio lead for the children and young people and a Health and Wellbeing Board member as well, I am pleased to report that the annual report for 2021-22 includes a reference to several new initiatives under the Starting Well. This includes the collaborative development of the healthy framework for schools and education to address both physical and emotional well-being and improve outcomes for the children, young people, staff and in the education setting itself. There is a range of work taking place to address the cost of living crisis and the impact this has had on the children and their families as well, including the continued delivery of holiday activities with food. In addition, I am pleased to see the development of a mental health and wellbeing alliance of providers and numerous campaigns to engage children, young people and the adults on key issues. I second the recommendations set out on the report. Thank you, Chair.
Thanks, Ted. Is there anyone else wishing to speak to the report, please? Okay, can we agree the report and its recommendations? Okay. Okay, thanks everyone. I can confirm that the recommendations are agreed. Item 9 is humanitarian support in County Durham. Can I ask Alan Patrickson, Corporate Director of Neighbourhoods and Climate Change, to present the report, please?
Thank you, Chair. This report provides an update to Cabinet on the support in County Durham that has been and continues to be provided for individuals and families seeking refuge in this country from conflicts around the world. The increasing scale of the global humanitarian challenge has resulted in the UK as a whole facing significant demands on the provision of refugee and asylum support, and this in turn has resulted in an increasing number of schemes delivering this important help at local authority level. As migration and asylum programmes have developed in response to the national and international pressures, our service provision has adapted, and this report points to a number of areas where new arrangements have been developed and also areas of further development for the future. The report highlights 5 programmes of refugees and asylum support that the Council is currently engaged in and includes 9 separate recommendations. As I go through the report, I'll touch briefly on each one, highlighting recommendations where appropriate as I go through. The report first picks up on an issue of governance. When County Durham's contribution to the government's humanitarian support effort was agreed in 2015, the Council and its partners were focused on delivering a single scheme providing settlement support to vulnerable families arriving from Syria. A humanitarian support partnership was established to ensure a joined-up approach, and this partnership established a set of principles for the delivery of support in the county, which have been maintained at the core of the service since then. However, it's timely now, as part of the Council's engagement, especially in the Asylum Dispersal Accommodation Programme, to review governance to support these principles as the needs of the various schemes diverge. Firstly then, a County Durham Migration and Cohesion multi-agency group is proposed that will help steer planning in response to the new responsibilities for the dispersal of asylum seekers. This is in line with good practice as established by the North East Migration Partnership. A second group focusing specifically on refugee resettlement is also proposed. The benefit of having 2 groups will be to ensure that the right partners are working together to meet the needs of the programmes and the individuals supported, while also recognising the common ground that exists. The Council's Children and Young People Service continues to receive requests for placement under the National Transfer Scheme for unaccompanied asylum-seeking children. This scheme was introduced in 2016 and became mandatory in November 2021, with over 3,700 unaccompanied children seeking asylum in the UK, meaning that the pressure on the scheme is increasing. And recent changes have come into effect nationally that impact here in County Durham. These changes have the effect of reducing the transfer deadlines set out in the scheme protocol, while also increasing the threshold for numbers of children transferred. The new arrangements come with additional funding, which is welcome, although this is recognised as not being permanent. Concerns over the pace of referrals have been raised with the Home Office by the Regional Partnership, and it's worth noting also the additional challenges posed by the number of age-disputed referrals standing at 20%. Earlier this year, local authorities were advised that the Home Office is also implementing a scheme of unaccompanied asylum-seeking children from Ukraine. The recommendation here is for Cabinet to note the challenges in providing placements for unaccompanied asylum-seeking children, particularly given the increased threshold and the new transfer deadlines. The Council first supported refugee arrivals in County Durham in 2016 under a resettlement scheme initially focused on supporting those fleeing from Syria. This model was later expanded to cover other countries in North Africa and the Middle East, eventually consolidating in 2020 into the United Kingdom Resettlement Scheme, the UKRS. An initial commitment by Cabinet to support between 250 and 300 vulnerable refugees by 2021 has been delivered, with the county resettling 60 families comprising of 280 individuals. In January 2020, Cabinet agreed to continue participation in the scheme for a further 4 years, anticipating welcoming a further 200 people in that period. The UKRS is a fully funded scheme, and the funding provided by central government has helped provide the local authority teams necessary to deliver this and the wider humanitarian support programme. In June 2021, local authorities were asked to support the resettlement of people fleeing Afghanistan, initially related to individuals who had been supporting the British military and government through a scheme that was then known as the Afghan Relocation and Assistance Policy, or ARAP. This was followed shortly thereafter with an Afghan citizen resettlement scheme designed to provide up to 20,000 Afghan citizens at risk with a safe and legal route into the UK. Both schemes are funded in a similar way to the UKRS, and County Durham has welcomed 6 families under this provision so far. The Department for Levelling Up Housing and Communities has also recently developed a separate route for families to find their own accommodation. This scheme runs parallel to the settled accommodation pathway, but it is an opt-in for local authorities. In County Durham, the size and the rural nature of the county may prove challenging for this scheme when it comes to providing the services to support integration, language and schooling. So the recommendations here are to agree to the continuation of the county's resettlement programme, expanding it to accommodate up to 3 phases each year, 1 phase focusing on support to Afghans and 2 phases under the UKRS programme, and also to keep under review the find your own accommodation pathway while not at this point opting in. In March 2022, in response to the war in Ukraine, the government announced 2 schemes to support Ukrainians coming to the UK. The Ukrainian Family Scheme allowed family members of British nationals and those settled here to come to the UK. The scheme allowed individuals to live, work and study in the UK and access public funds. Arrivals would be supported by family members. As of August, more than 50,000 visas have been issued across the UK through this scheme. The second scheme was through the Homes for Ukraine sponsorship scheme. This offered a route to Ukrainian citizens who are 18 or over to move to the UK when matched with a named sponsor. The scheme relies on members of the public hosting individuals and families for a minimum of 6 months, with wraparound support provided through the local authority. Both of these schemes have been well publicised over recent months and are generally well understood. And while its sponsorships arrangements are unique to the individuals, the Council does have responsibility for background suitability checks and for providing support to arrivals, which attracts funding from central government to cover local authority costs. As we move to the end of the 6-month minimum period for sponsor guarantees, the support teams are contacting sponsors to understand intentions for the future and delivering moving on advice where needed. In recognition of the fact that some Ukrainians are looking to move on and will face challenges in finding suitable accommodation, it's proposed to extend an existing model currently used by our Housing Solutions team, which provides early intervention to prevent homelessness, working with private landlords to overcome some of the barriers to rental, including financial incentives, rent in advance and cash bonds. The introduction of this scheme for Ukrainian families where necessary is a recommendation of this report. British National Overseas has an immigration status created for Hong Kong nationals in the 10 years running up to the handover of Hong Kong to China. From February 21, in response to unrest in Hong Kong, the government relaxed restrictions and allowed individuals holding this status to live, work and study in the UK. And while a report sets out further details of this scheme, no cases have been presented to the Council to date, so the recommendation is therefore simply to note the scheme. Finally, the report covers the new arrangements in the county under the dispersal of asylum seekers accommodation arrangements. The asylum system is under considerable pressure, with over 25,000 asylum seekers currently in hotels across the country. In April of this year, participation in a previously opt-in dispersal scheme became mandatory, helping to move asylum seekers from hotels to more suitable dispersed accommodation. The announcement also confirmed the allocation of funding to support local authority efforts, although the scheme is delivered predominantly by a contractor, Mears, working with the Home Office. Work is currently ongoing with councils across the North East and the Home Office to develop a regional plan for the dispersal of asylum seekers, and this will be concluded later this month. In preparation for the new arrangements, however, council teams have been working with partners around the county, learning from the experience of other local authority areas to put in place a new arrivals pathway. British Red Cross, an organisation with considerable experience of delivering this pathway across the North East, has agreed to lead in County Durham, working with a range of other partners. The recommendation here are therefore to note the commencement of MEARS to secure properties in the county as part of the mandated asylum dispersal scheme, and to support the targeting of funding at developing the community and voluntary sector infrastructure to support the new arrivals. Chair, as can be seen from the content of this report and the recommendations, the Council continues to rise to the challenge of delivering successful humanitarian support programme, helping support individuals coming to the county, providing a place of safety for those in need, and helping new arrivals become valuable and valued members of our communities. The recommendations are set out throughout are summarised in paragraph 9.
Thanks, Alan. Can I invite Councillor Alan Shield, Cabinet Portfolio Holder for Equality and Inclusion, to speak to the report, please?
Thank you, Chair. This timely report brings together for Cabinet a useful and also an impactful summary of the work going on in our Council, working with our valued and trusted partners across this important but also sensitive area. County Durham has always been and will always be a welcoming place for people arriving here, seeking sanctuary and a place of safety. And sadly, events around the world in recent years have meant that more people have found themselves in that precarious position. Our humanitarian support efforts stretch across a number of council services, including our partnership teams, housing and finance, and the increase in demand has meant that we've had to step up our efforts to provide support and practical solutions for those arriving here in each new scheme and each new conflict. I must acknowledge and appreciate the incredible contribution of our partners and colleagues in the voluntary and community sectors who consistently step up to support this work, demonstrating time after time the strength and compassion of the community organisations across our county. As the report demonstrates, the schemes that we support are wide-ranging and varied, involving people fleeing conflict in Syria, Afghanistan, Iraq and Sudan, as well as the documented ongoing conflict in Ukraine. A war in Europe is something which was inconceivable 12 months ago. Each issue brings its own challenges, and I am pleased to be able to report that we have risen to these challenges every time. The newest of these initiatives to come our way is now the mandated involvement in the national scheme for the dispersal of asylum seekers who are currently located in contingency accommodation across the UK, costing an estimated £1.3 billion every year. The report sets out the work that is ongoing to prepare ourselves to once again help those in need, whilst also being sensitive to the demands on services and the pressures on our communities. The scheme is delivered directly by a contractor to the Home Office, which we must acknowledge brings risks of lessening the control and influence of the Council in the outcomes. However, I am confident that our partnerships will remain strong and effective in the delivery of the scheme, and note that there is further work to be done in the coming weeks and months to finalise the regional plan with the Home Office, with our North East local authority colleagues across the region. The report contains a number of recommendations that draw on our experience to date to put us in the right position going forward to help maximise our effectiveness in the various roles we play. And finally, Chair, I would like to place on record Cabinet's tribute to our staff who continue to deliver these programmes with care and sensitivity, sometimes dealing with people who have experienced trauma and distress and loss in ways that most of us are fortunate enough never to know. They are a huge credit to our organisation and to the concept of public service that we all hold so dear. Chair, I move the report and all the recommendations duly outlined.
Thanks, Alan. Can I invite Councillor James Rowlandson, Cabinet Portfolio Holder for Resources, Investments and Assets, to speak to the report, please?
Thank you, Chair. I'd like to echo the words of Councillor Shields. This is an insightful but also sobering report demonstrating how the impacts of conflicts around the world bring challenges and issues to our door here in County Durham. The report shows not only the breadth of our activity in this area, but also the depth, and in this respect it is vital that we match our resource with our ambition. We can see that we have used the financing available through the funded government schemes wisely to maximise our impact across all initiatives, and I would particularly highlight the recommendation that we also use this resource to enhance the wider support network through the voluntary sector so that our vital contribution remains available and robust. We also must do what we can to help the transition of people caught in these schemes into a more stable position, and the work of our housing team is essential in this regard. The incentive scheme proposed in the report is a useful and innovative way to invest in the present to avoid greater burdens in the future. Chair, this report that gives us all cause to consider the circumstances of others as well as the practicalities of delivering important and effective help, and I am happy to second the report. Thank you, Chair.
Thanks, James. Is there anyone else wishing to speak on this report? Okay, can we agree the report and its recommendations? Okay, I can confirm that the recommendations are agreed. Brings us to item 10, which is any other business. I haven't been notified of any other business for today's meeting, so therefore I'd like to take the opportunity to thank everyone for taking part and to those members of the public and media who have watched online. That concludes the business for this meeting.